And this brings us to the second part of this video, which is a look at Anna Campbell's mental deterioration over the years from a medical perspective. Okay, so I'm a final year medical student, and I thought that it would be important for me to kind of debunk some of the things that she said in her last video, because I felt like it was just a bit medically inaccurate, as well as I've seen so many red flags from her video, and that could kind of explain why she keeps getting into all this mess in all of her relationships. And yeah, we'll get into that. We'll explain why this has significance. Now, for this part of the video, I'll be referring to her video, every psych medication I've tried and how they made me feel, because I feel like this video is very telling and there were some misconceptions in it, so I want to get into that. As well as for this part of the video, I'll be linking information from the Mayo Clinic, NHS, Healthline, and WebMD, so you can definitely go and check out all of these articles yourself, as well as all these articles are recently updated, so they're not something that is really old, they have been updated this year. So let me start off the section by saying that what Natalia Taylor said at the beginning about Anna having studied psychology and knew a lot about drugs is a common misconception.
And I think there was a certain level of trust that I had with this person because, as far as I was aware, she had a psychology degree and she knew a lot about drugs.
So I want to stress out, I don't know if Anna uses her psychology degree to hold some sort of power over young naive girls with no drug knowledge, or her drug knowledge, she means her past to drug experimentation. But I need to say that psychology and psychiatry are two different things. Psychologists are not allowed to prescribe medication legally. They can just oversee the patient along their medication journey, so using a psychology degree to justify drug use is very manipulative, as her area of expertise is in psychology and therefore medication has little to do with that. As well as there's only 5 states currently where psychologists are allowed to give medication. Other than that, psychologists who do give medication are required to receive proper training and are permitted to prescribe only certain medicines used in the treatment of mental disorders. So secondly, the first red flag that I observed at the beginning of the video was that she stated she was on her first drug from the age of 19 to 25. So the red flag lies here. She said that she was on 450 mg, which is not allowed anymore, which is a common misconception.
I needed to be put on medication, and this was when I was first put on Wellbutrin. And at the age of 25, they put me on 450, which is not allowed anymore.
According to Mayo Clinic, 450 is the highest dose, but it is still allowed, while some doses can go up to 522 mg per day. And this article was last updated on February 1 of 2021 of this year. So that is an inaccuracy in her video. Another red flag is how she said that she was putting herself on and off the medication and forgot to take it, which is very dangerous, as it can lead to experiencing more side effects than necessary.
I was taking myself off of it, putting myself on. I would forget to take it. I would have phases where I took it perfectly. It was just really weird.
Abruptly stopping the medication can lead to side effects like agitation, anxiety, dizziness, a feeling of constant movement of self or surrounding, headaches, increased sweating, nausea, trembling or shaking, trouble with sleeping or walking, or unusual tiredness. So she had to sit with a doctor and gradually reduce the dose instead of just going off it abruptly or not just missing doses altogether. Another thing I want to add is that around the time she was taking it, she was with Natalia Taylor, and we know that they did hard drugs together, which can cause unwanted drug interactions, which once again is dangerous. Illegal drugs is usually not recommended while taking antidepressants, as it can cause unpredicted and unpleasant side effects. Anna has said that she has experimented with cannabis, cocaine, and ketamine, which are all not advised with antidepressants, as well as alcohol, which can worsen the symptoms of depression or other mental health conditions. Another misconception and a red flag that I saw in her video is that she said that she was up to 450 mg of Wellbutrin, which is illegal, which is, I stated earlier, is a common misconception.
It turned 25. The doctor upped me, and the doctor upped me to 450 milligrams of Wellbutrin, which now I'm pretty sure is illegal and they can't up you that high. It's too high.
Another huge misconception in her video is that she said that she can't be on antidepressants anymore, which is once again very untrue, since antidepressants can sometimes trigger a manic episode. According to the Mayo Clinic, people with bipolar need to be prescribed an antidepressant alongside a mood stabilizer or an antipsychotic. So her constantly mentioning that in her video is just medical misinformation.
And that is why I can't be on antidepressants anymore, or I'm not supposed to be on antidepressants anymore.
So her manic episode is a result of taking antidepressants without an antipsychotic or a mood stabilizer, not because of the reasons that she gave in the video. Another thing that screamed red flag to me was the fact that she would try all these medications and decided she hated all of them before waiting out the side effects. If side effects seem intolerable, people are often tempted to stop taking antidepressants or reduce the dose on their own, which they shouldn't do. It's very dangerous, as it can cause symptoms to return, and stopping the medication may cause withdrawal-like symptoms. Another red flag is that she said she stayed unmedicated for a year with her bipolar, which is very dangerous once again. So it's important to note that there are many complications when bipolar is left untreated. It can result in some serious problems that can affect every aspect of your life. So treatment is very important, and getting diagnosed and getting treated is very, very vital. While bipolar is generally lifelong, treatment helps so many people manage their symptoms day to day. And one of the biggest risks of untreated bipolar disorder is that it tends to get worse the longer it goes untreated. Delays in diagnosis and treatment can lead to personal, social, and financial problems, so it's very important. As well as these are some of the dangers, once again, of untreated bipolar disorder. As well as, I guess the biggest takeaway is that untreated bipolar disorder can lead to social, emotional, and financial problems. As well as early diagnosis and early treatment offer a lot of people a good chance for a full and productive life. So another red flag that I want to mention is that she said that Wellbutrin is the shit that started all of this. What she fails to realize is that she herself is to blame for that. She was not taking the medication as prescribed, as well as the doctors at the time were unaware of her bipolar disorder. So she needs to understand that medication is a trial and error until she finds the right one. She can't go around blaming every medication, every doctor that she sees. I think that is very, very toxic. Another red flag that I saw from the video is that she stopped taking another medication because of nightmares, which is once again a very common side effect with antidepressants when you first start taking them. So I can see that she did not wait out the side effects, and she's done that for a couple of these medications, which is really bad again. Another red flag that I observed is that she constantly changes psychiatrists, which once again is not recommended. If she was to change psychiatrists, it is very, very, very important for her to have a list of all the issues she's had with medication or treatments in the past, her goals, allergies, medical history, treatments which have not been discussed before, and symptoms and experiences, and not just the diagnosis. See, my issue is that I feel like every time she goes to a new psychiatrist, they're usually unaware of her past treatment plan, or they're also unaware of her bipolar. And as we discussed earlier, the treatment of bipolar differs from other mental health issues, like I mentioned earlier, so that could explain why she was constantly prescribed medication for depression without a mood stabilizer or antipsychotic. That can also explain why she was given trazodone, which has the capacity to induce mania. For trazodone, it's important to tell the psychiatrist your history of mania or bipolar disorder. The next thing I want to talk about is that she's on Xanax now, which I must add is a benzodiazepine. They're generally not a core treatment for mania. However, they can control certain manic symptoms. How they're taken is they're usually taken for a brief time, up to 2 weeks or so, until mood stabilizing drugs get into effect. Now, what I'm guessing is that Anna did not keep up with her treatment plan, or she did not reveal all of her past history to her psychiatrist, because usually benzodiazepines can be habit forming or addictive. So they're usually avoided in people with history of alcohol or substance abuse, unless it's necessary or for a short period of time. But she took it for 6 months. So what I can guess is that her new psychiatrist wasn't aware of all her past history, as usually it's not given to people with history of alcohol or substance abuse, or given for a short period of time. And the final red flag is that she said that Zoloft is one of the worst medication to be prescribed with bipolar disorder, which is once again a misconception, and it is very untrue. It is actually used for bipolar disorder. The only difference is that the psychiatrist must be informed if you have bipolar disorder or you have tried to commit suicide. As once again, Zoloft is one of the most commonly prescribed medication for bipolar disorder. The only difference, once again, is that it has to be used in conjunction with a mood stabilizer. She said a simple Google search will show you that it's the worst, which is very untrue. It is actually one of the most commonly prescribed medications for bipolar. And she also needs to realize that with Zoloft, there is a huge drug interaction when it comes to alcohol. So she should probably research that. Lastly, a thing I wanted to say about this video is that she keeps asking her fans for their opinions over Instagram and YouTube about her medication, rather than taking her concerns to her psychiatrist, which is actually the only person who can actually give her a proper treatment plan. And another thing is that she needs to realize that psychotherapy is a key part of the treatment process. Instead of her always going to the psych ward a day or two, every few months, she needs to keep up with psychotherapy, and that is very, very, very important. So the big takeaway from all of this is that either Anna hasn't fully committed to getting better, or she is using trauma as a badge of honor. She needs to stick to her strict medication regime, follow up with her psychotherapist, avoid alcohol and any illicit drugs, stop changing psychiatrists based on her wants. That is the only way for her to overcome all her hurdles, because at this point, the way I'm seeing it, she is the only one coming in between her treatment. If you have made it to the end of this video, I absolutely love you, and be sure to subscribe, comment, and let me know what you think about all of this and what I've said. So you can also go back and read up all the articles that I used on this video, as well as just let me know what you want to see in the future. So yeah, thank you.